Welcome back to Coast Vue. I really enjoyed that conversation with Steve and Michelle about the revitalization project for the high water mark in Bay St. Louis. I think it's going to be a wonderful gateway coming in from I-10 into downtown Bay St. Louis to kind of give people a great flavor of what to expect who have not been to downtown Bay St. Louis before. If you're interested in that, do some research, reach out to them. They're doing this call for artists. I think it's going to be super cool. Hey, I have another quote I want to share with you. It's from my friend Susan Griggs. We used to work together. She was an editor at the Keesler News, and we published it at the Sun Herald, and we worked together for many years, and both of us in retirement, we stay in touch through Facebook. But she posted this: there's a thin line between confidence and arrogance. It's called humility. Confidence smiles, arrogance smirks. That's true. That's true. I often say that the more we learn, the more we better learn how much we don't know. That recognizing that life is a journey of discovery, and the older you get, the more you better realize that. That's what humility is all about. So a guy who I know who is not arrogant at all, but who has had some good confidence on this show throughout the pandemic is my friend, Dr. Nicholas Conger, who's an infectious disease doctor at Memorial, and he's become a good friend over the last couple of years. So it's been a while since we chatted, Nick. It's good to see you, my friend.
Hey, it's good to see you too. Thank you for that nice introduction. It has been a while, and I pray that I'm smiling and not smirking over here.
I've never known you to be a smirker. That is for sure. I tell you that the pandemic, if you just go back over the last couple of years, it's humbling, isn't it? I mean, to be taught how to deal with a pandemic, to be an infectious disease doctor, and to see the many faces of COVID over the last couple of years. It's been a journey of discovery, hasn't it?
Yeah, that's certainly right. And things are changing so fast. And so I think even on your show, I've hesitated to predict because, we just didn't know what was around the corner with this virus. And we can make educated guesses, but things have changed so much. And we're in this information age where people want instant information, and sometimes it's not there. And so sometimes the void gets filled with opinion. Another point to make is that, this virus right now is so different than it was 2 years ago. And I was thinking back about it, in the military, we talk about you don't want to fight the last war. You want to fight the next war. So you don't want to gear your military towards what it was like in World War II. You want to look forward. And I feel like some of that's going on with COVID, where people are still fighting the last variant. No, man, things have changed. This is a completely new, different variant. And we got to change all of our strategies, individually at the patient level and public health wise, because things are changing that fast.
Well, I talked a little bit about this the last time we were together, but you've maintained from the very beginning that if this runs the natural course of a pandemic, that the next iteration from Delta could be more contagious but less deadly. We talked about the really almost, I don't know, the very difficult, let me put it that way, position the CDC found itself in by trying to create a one-size-fits-all scenario. Right. And Delta couldn't have been Delta and Omicron, but the iteration from one to the next, very different kind of virus, wasn't it?
Yeah, absolutely, very different. And Delta was kind of a minor variation, but a much more deadly variation on those first strains, and had an ability to evade the vaccine a little bit. But you still got a decent benefit sometimes in preventing or decreasing the severity of illness, whereas the Omicron had so many changes on the surface, or so many changes in the way that it was brought into the body, that it just completely evaded all the vaccine protection from preventing infection and preventing spread. Still, people did get protected from severe disease, but it just was so contagious. I think I saw something that said 140 times more contagious than the alpha and the gamma strains. There were some of the earlier strains. And so, that's incredible. And much milder.
Say it again now.
And much milder too,
Much milder. Still, you look at the numbers, because again, you're talking about so many infections, and what we don't know is the number of home tests that have been taken, or people who just thought they had the sniffles and didn't get tested. So we really don't know the true numbers. Have there actually been any official estimates beyond the testing of how many people got the Omicron virus?
Not from what I saw, and I kind of took the stance of, but I'm just one kind of voice out here in the wilderness though. But I kind of took the stance that we were emphasizing too much the testing. Omicron was so prevalent, and we're testing people coming to the hospital. Almost everyone tests positive when they're coming in for other things, and it's so widespread. And I heard people, on the national news and stuff saying, we got to test and isolate. Well, that wasn't working. This was so contagious. And I was of the opinion of, well, what do we do like when the flu is widespread? At some point you stop testing, you say, hey, you probably got the flu. And it was at the point where I think you can make a clinical diagnosis. You have the classic symptoms. I don't know why we were maintaining this. Therefore, because you're sick, you got to get in a car and drive somewhere and get tested. All that does is make you go somewhere and expose more people when it's pretty obvious that's what you have. So again, I'm comfortable with, hey, there's a lot more cases out there. We may not be able to quantify it because it's so widespread and because it's so mild. I'm emphasizing that some people still do get sick. Some people are still dying from COVID, but the numbers are so much lower. To me, we should have backed off from this uncontrollable urge to test.
Yeah, it was interesting. Even though the data from South Africa early on, and you and I talked about this, was suggesting more contagious, less deadly. The CDC didn't change its tune. The national news media didn't change its tune. And part of the thing that I think made this more sort of compelling for them was that there was this moment where the northern states, the southern states had been sort of overcome by Delta, and our hospitals had been filled up, et cetera. And then it slowly, even though you always said it didn't matter if you locked down or not, eventually it's going to run its course. And we saw Delta, as Omicron was starting to come into the south, you saw Delta starting to take hold in the northern part. It was almost impossible to craft a message that fit both. So right. I guess they just went with the more severe, situation, because Delta, when it was taking hold, was it was what we experienced here in the south. But what almost like a winless scenario for the CDC in a lot of ways.
Yeah, and I agree, and I think we've talked about this. This kind of top-down, one-size-fits-all mentality for this outbreak, I think, has been wrong from the very beginning, and it would have been nice if there's more collaboration. And some of the governors in different states, had it right based on what was going on in their states at the time, and I don't know if that brings me up to that. I don't know if you saw that Johns Hopkins study on the lockdowns. Interesting to me,
did.
It was written by economists. And because I think the doctors are still scared to speak up and say, hey, I think we got this wrong. I think there's still a little reluctance to speak up, which is a shame. But it was written by economists that looked at the data from an economic standpoint and showed that very, very marginal benefit from lockdowns, but severe repercussions. So there was always that balance, And so it's easy to Monday morning quarterback a lot of decisions made on both sides of the kind of the political spectrum and the thought process.
Yeah, early on, it's easy to forget, and a lot of people do forget this incidentally, but early on, we didn't really know what we were dealing with, and it was kind of a scary moment. Right. And but as we learned more and got more experience, we knew for sure that we had to protect the elderly and the vulnerable. You never ever came off of that. You still believe that's extremely important. You still hear of elderly people dying today, unfortunately, right. Because even the Omicron variant is unforgiving if you have pre-existing situations. That's still right. True, right?
Yeah. And one of the point to emphasize there still going on is the kids. And obviously I have children. I care about kids. No one wants to see kids die. From the very beginning, this virus showed that it was devastating in the elderly and those with severe medical problems, not so much in kids. And now we find, I still run into doctors that say, I'm scared my kids are going to catch it. And my answer is, why? I'm scared you're going to catch it, not your kids. Your kids are going to be fine. Yeah. They're not big vectors. And still, now we have in a country, we have all the kids masked in school and nowhere else. And some of these things don't make sense to me. It never really was a severe risk for kids to begin with. Even with Delta, it was over exaggerated. There were obviously, any death of a child is tragic, but compared to the flu, even so much less mortality for children and so much more for the elderly. And so I do think that there was room to really craft our national and our local plans towards protecting the vulnerable and letting the less vulnerable have life as normal as possible.
What's interesting, even this week, you see You see petitions by pharmaceutical companies to get emergency use of vaccines for very young kids, and you see national media interviewing parents who just can't get to the doctor fast enough to get their kids vaccinated, and blah 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 blah. Um, we've been reticent. We've been reticent for our grandkids to not rush down that road. That's kind of still where you are, isn't it?
Yeah, I think everything should be a risk-benefit situation. Clear benefit in the elderly, clear benefit in the middle age, especially with multiple medical problems. Not so clear benefit in the healthy young adults, really not so clear benefit for teenagers. And well, you really have to show me that there's a clear benefit for the younger kids. So I really think that this should be a informed decision by parents individually. I really would hate to see a top-down mandate when natural infection may provide better, broader immunity and not maybe not even as much risk as a vaccine. That is very low risk.
When we come back, we'll continue our conversation with Dr. Nicholas Conger and continue the conversation. See you after this. We have Dr. Nicholas Conger, an infectious disease doctor from Memorial. Nick, the last time you and I talked, it's been a while ago, and one of the things I asked you during the break, specific to me, I wanted just to get your opinion about something I've talked to my doctor about, and that is after I had COVID and then I had 2 Pfizer shots. After COVID, I had a bout with premature atrial contractions, which unfortunately I still kind of deal with. When I got the vaccine, it sort of reoccurred again, and it's just something I've had to deal with. Very healthy, still very active, very focused on my physical health, et cetera. But it's just something I had to deal with. And you said, okay, if you've had COVID and you've had at least 2 of the shots, you probably have pretty extreme immunity. And not long after that, and I want to read to you something that I read, just one quick sentence. In addition, there are some data suggesting that COVID-19 infection followed by vaccination may provide extremely strong immunity, but we just do not have enough data to know whether this is can substitute for vaccine booster or not. Since then, even more people are weighing in that if you've had COVID and had the vaccine, especially if you have a situation like I have where you've had just kind of underlying, I didn't have any heart issues prior to getting COVID, but the lingering, I mean, I'm reading a lot more about heart arrhythmia being sort of part of if there's a long COVID related to your heart, that's one of them. Right. I don't know how much you've had to deal with that since the last time you and I talked, but I've been reticent to get the booster because of that. And I feel pretty comfortable where I am in the process.
Right. And so, again, that's been a point of frustration for myself and many clinicians, the silence on the benefit of natural immunity. And we all knew it was there, and we all knew it was very effective. And, a combination of natural infection and vaccination, is probably better than either or. And natural, and we say, well, we don't know how long it lasts. Well, we don't know how long the vaccine lasts. And so, the emphasis has been on vaccination, as if that's the only form of immunity. And I really wish that, again, there was some more nuance there. We should have been more worried about immunity, who had immunity. We could measure it with spike protein levels, with antibody levels. We could measure people's immunity. And that always should have been a viable substitution for vaccination in my mind, because that's the same end. That's what we're going for. And so the fact that was completely ignored, it's understandable why a segment of the population is really upset about that. So that's what I care about, is people not getting sick and dying. I don't care what pathway they got there.
You've been fighting in the trenches there at Memorial for 2 years now. What's the latest on therapeutics there?
So one of the interesting things about the older therapeutics, that I'm glad you asked. So one of the things I'm noticing, so during that Delta surge, we were using things like remdesivir and tocilizumab. One's an antiviral, one's an anti-inflammatory. And there were some studies that showed some subtle mild benefit. And, at times I was questioning whether we were really doing any good. Are these drugs really helping? Because so many people went on to get more sick and die. And it just seemed like maybe these drugs really don't do anything. But some studies came out that said, yeah, they are beneficial, especially when given early or in the right situation. The interesting thing with this new strain, Ricky, is that these drugs really seem to work better. Like, because it's a milder strain, maybe Delta was just so overwhelming at the way it hit the lungs. And this one is not near, it doesn't even get in the lungs as well. And so, when we bring people in who have moderate illness and we give them these therapeutics, they're doing a lot better, like 2 or 3 days on remdesivir, and they feel great. And it wasn't that visible to the eye with that last surge. And there's
Yeah,
also, yeah, and sorry to go on, but there's also some newer oral medications. That one, Paxlovid, that's a really good drug. It's got a 90% reduction in hospitalization and death. But you got to get it early. You got to get within the first 5 days. But, we have some. So we're trying to restrict it to people who are at most risk to advance to severe disease. But certainly, if you're newly diagnosed and you're at risk, ask your provider about that new oral medication. It's pretty good too.
So part of the issue with several of these therapeutics was that if you gave them later in the process, in other words, once someone became severely ill, was in the ICU, they had limited impact. Do you find with the Omicron, they still have limited impact in advanced stages, or maybe they work somewhat better?
Yeah, still some limited impact in late stages, but still better than Delta. Like that tocilizumab, we kind of give that right when everything's exploding and their oxygen requirements are skyrocketing and they're in this massive inflammatory phase. And, the data on that was you gave it to 25 people and you might save one life, which still, I'd still give to 25 people hoping to save one life. But it would be even later in the stage, and they've turned around, which it wasn't always that obvious with the Delta strain. And the next day they say, hey, I feel great. Can I go home? And you're like, well, wait a minute. We thought you were headed to the ventilator yesterday. So we are seeing even later some better outcomes. Maybe it's just because the virus, again, is more mild and they were going to get better anyway. You never know. But it does seem to correlate with using these drugs.
What next? What are you hearing about other strains?
I don't know. I haven't heard a whole lot about other strains. This strain was so contagious. Like I said, 140 times more contagious than the original strain. You would, for a new strain to take over, it would have to be even more contagious and simultaneously evade all that natural immunity that's out there now with this one and all that vaccine immunity. So I'm kind of hopeful. I don't like to predict that we're in the new, maybe a new subtle strain comes through, and as the herd immunity wanes, it might get a decent part of the population sick. I'm hoping it kind of ends more like seasonal flu, like we talked about from the very beginning. But you never know with this virus. I wouldn't bet for it, and I wouldn't bet against it.
Well, for that reason, we'll stay in touch with you. You've been a practical mind, a confident, practical mind, never arrogant. As I said at the beginning of the show, you've been a terrific informer for all of coastal Mississippi and beyond since this thing started, and we appreciate your friendship, and we'll stay in touch with you, my friend.
Yeah, that sounds great. Thanks for having me back.
Take care. This has been Dr. Nicholas Conger, and he's an infectious disease doctor at Memorial. Have a great day. We'll see you later.